There's no getting around the fact that the human body isn't indestructible, and whether you're an athlete or involved in an accident or are just reaching your golden years, your body is bound to need some form of medical attention.
Our philosophy is to provide the highest quality care to our patients and do it in a way that's cost effective.
Michael Engel is president of the Orthopaedic Surgery Center. He says there's a hidden cost in healthcare that people may not know about. It's referred to as the site of service cost.
Currently in our system, when you have a hospital-based service, the cost for that service, if it is at a hospital-based facility, is significantly higher than it is if it's at an ambulatory surgery center, which is what we have, or even an office-based.
Engel says having a corrective procedure to treat a common issue like carpal tunnel syndrome costs roughly 2 to 3 times more at a hospital than if one were to be treated at an ambulatory setting. The main cause of that cost increase is due to more people being involved in the care process and the time spent at the medical center.
As opposed to the hospital, outpatient surgical centers are a little more on time, a little faster pace, and you can get more stuff done. I mean, there's not as many links in the chain to complete the process.
Les Schwendeman is medical director at Orthopaedic Surgery Center. He says with more older people remaining active, they don't need to stay in the hospital as long.
And I think the industry likes it because the industry pushes us obviously towards cost savings, and as opposed to a lengthy stay in the hospital, insurance companies look upon outpatient surgical centers to do the same thing and provide the same or better outcomes, and I think that's where things are being driven towards an outpatient setting.
1, 2, 3.
In January, leaders of the Orthopaedic Surgery Center held a groundbreaking for a $7 million ambulatory surgery center in Boardman. Once built, the 13,000 square foot surgery center will feature new technologies and is designed to improve the medical treatment experience for both doctors and their patients.
The environment that the patient is going to experience at the center, private orthopedic suites, again, the natural sunlight to always give them a sense of their surroundings and the outside environment, it's going to be pretty special, and I think that has an effect on our physicians and our staff as well.
Taylor Sierra is administrator of Orthopaedic Surgery Center. He says future growth was a big factor when plans for the new center began 4.5 years ago.
There's phase 2 and phase 3 plans to be able to expand the number of operating rooms in the surgery center, to be able to put a medical office building on site with imaging capabilities, with therapy capabilities. So we've been able to build that into our growth plans.
It's a location that all of our patients feel comfortable getting to. I think we can draw from the Tri-County region of Trumbull, Mahoning, and Columbiana counties at the location that we're at. And the easy access that we have to some of the freeways allows us to even draw outside of that. And with some of the things we're doing, we expect to have that draw.
We'll be able to get more of what we want, like I said, bigger rooms and more rooms, which will be beneficial, bigger pre-op and post-op areas, and a better workflow.
And since the center is physician-owned and independent of larger medical systems, Engel says the Hippocratic Oath will play a big role in business decisions.
I think it drives our center. I think it drives our mission. And I think ultimately it's one of the things that's going to drive us to be a leader in the marketplace, because at the end of the day, patients are going to be the ones that get to choose. And I think patients and physicians are much closer together in their values about healthcare than the insurance industry or the hospitals.